Despite some intense opposition out there to the Affordable Care Act by some members of Congress, it is the law of the land, and today's the first day of what's called open enrollment. Perhaps no one better understands how this new law will affect so many Americans out there than the Secretary of Health and Human Services, Kathleen Sebelius, is joining us right now. All right, so let's talk a little bit, Madam Secretary, about what's going on. We're hearing that there are serious glitches out there. Even the president acknowledged it. Tell us how bad these problems are on this first day of open enrollment. Kathleen Sebelius, can you hear me? It's Wolf.
I can. Hi, Wolf. How are you?
All right. Thank you so much. All right. You're at the White House. We just heard from the president. Even he is suggesting there are some glitches out there on this first day of open enrollment. What's going on? Because you've had a lot of time to prepare for this day.
Well, I think what we're seeing, Wolf, is a very high volume of interested Americans, and that's very good news. So the simultaneous hits on the website, we had over 1 million visitors before 7 a.m. this morning, and we are working as we speak to make sure that we can process people in a more timely fashion. But I think the volume-related issues are ones that we welcome, frankly. It shows how many people are eager to get real information, eager to see plans side by side, make a comparison, figure out what they might qualify for in terms of financial help, and then make a good choice. Just to remind your viewers, this is an open enrollment period that lasts for 6 months, starting today, October 1st, lasting all the way till March 31st, 2014. So it isn't that you miss something if you don't visit the site today. If people also want in-person help on the phone, we have a toll-free call-in line with translators available who speak up to 150 languages. So we're thrilled that so many people have paid attention, have visited healthcare.gov. We welcome them to keep coming, shop, get information, ask questions, make sure you understand what plans might work for yourselves and your families. And for the first time, for that 15% of Americans who don't have affordable health coverage, they finally have health security headed their way.
So what happens over the next 6 months? Some people decide they don't sign up for the Affordable Care Act, sign up for health insurance. What happens after March to those people?
Well, at the end of March, when those individuals who can afford health insurance, who choose not to purchase it this year, when they pay their taxes, they'll be asked whether or not they have health insurance, and they will owe a fine as part of their tax bill, making sure that we encourage people to sign up, because you can't pick and choose when you will be sick, be in an accident, have a diagnosis, and we think it's much better for people to have some personal responsibility. But for the first time, a lot of people who have been priced out of the market or locked out of the market with a pre-existing health condition have seen a change in those rules. Companies have to compete for their business based on service and based on price, and we know that for the large number of people, that 15% who don't have coverage, they can actually find a plan in their home community with a private company for less than $100, less than the price of your cell phone bill. And that's very good news for individuals like the people who were with the president in the Rose Garden just a few minutes ago.
I've heard from a lot of young people especially who've suggested they're willing to pay that fine because it's going to be a lot less than signing up for health insurance. They think they're healthy, they may be in their 20s and 30s, and so they're not going to sign up, but they're willing to pay the fine. What kind of fine are you talking about would be levied on their income tax returns?
Well, the first year, the fine is $95. It gradually increases over time. And I know there's a lot of belief that somehow young, invincible Americans will never sign up. We didn't see that when the law changed to allow young Americans to be covered on their parents' plan. We have 3 million young adults right now who were previously uninsured before the Affordable Care Act who now have affordable coverage. I travel all over this country and hear from young people each and every day who say, you know, it's got to be affordable. I've got to be able to pay it in my overall income. But I know it's really stupid not to be covered. I know something could happen. I know I could fall on the basketball court or be in a car accident, and I'm one step away from bankruptcy or putting those bills on my parents. So if it's affordable, I want to take a look, and that's what we're saying to people. Visit healthcare.gov, find out options that are affordable for you. We also will have for young Americans under 30-year-olds a catastrophic plan to choose from if they don't want full coverage, but they want to make sure if some terrible accident happens or they have to have a serious surgery that they won't be bankrupt. They can choose a catastrophic plan or full coverage plan, and we think the options are affordable enough and understandable enough that it's really a brand new day for lots of Americans.
Yeah, there are 4 categories: the bronze, the silver, the gold, the platinum. You pay a lot less with the bronze, but you get a higher copay, a lot more deductible. All right, but those are just some of the issues out there. Kathleen Sebelius, thanks very much for joining us.
Great to visit with you.
Kathleen Sebelius, the Secretary of Health and Human Services.